and welcome to this episode of Elimination Exchange, a podcast series hosted by the Global Institute for Disease Elimination, or GLIDE. I'm your host for today's episode, Priya Knason, and it's my pleasure to welcome our guest for the episode today, Kelly Willis, who's Managing Director of Forecasting Healthy Futures. Welcome, Kelly. It's a pleasure to have you here with us today.
Hi, Priya. Thank you. It is nice to be here as well. Yes, I'm Kelly Willis. I lead an organization called Forecasting Healthy Futures that I'll be happy to tell you a little bit about. I've been working in global health and development for close to 25 years now, primarily in health system strengthening and infectious disease elimination efforts worldwide. But for the past few years, I've been very focused on climate change and its impact on human health. And that's what Forecasting Healthy Futures is all about. So FHF, as we call it familiarly, is a coalition of organizations who are committed to protecting global health gains and even expanding global health gains, even in the context of climate change.
Thank you so much, Kelly. Really excited to have you, I think, for many reasons, because I think FHF is so interesting, right? Because it's a coalition of it's bringing together the health and climate folks. And I know you're doing some really exciting work as well in terms of modeling and sort of looking at predicting the impacts of climate on human health. And I'm wondering if you could talk a little bit about that. I know you have IMAX, or the Institute for Malaria and Climate, and sort of how we're seeing already the impact of the climate crisis on human health and infectious disease, or specifically malaria.
Yeah, I mean, if you step back, I think we can safely say that everywhere in the world, we're feeling the health impacts of climate change. Maybe first and foremost, just rising temperatures, the fact that extreme heat and even slow onset heat increases exacerbates underlying health conditions. So that's a worldwide challenge. But when we start to talk about infectious diseases that plague lower and middle income countries, many of those are particularly climate sensitive. And so that's where our work is focused. Many infectious diseases are spread via vectors like mosquitoes and ticks and even snails. And their habitats are changing, and new geographies are becoming more hospitable to these parasite hosts that can then transmit diseases from person to person. So diseases like malaria and dengue are particularly climate sensitive. In fact, dengue is in the middle of a very, very disturbing, alarmingly quick acceleration in both its geographic scope and the transmission rates and people who are getting sick and dying from dengue. So that's where our work is primarily focused. You mentioned the Institute for Health Modeling and Climate Solutions, or IMAX as we call it. And we're doing some fantastic work there to better equip low and middle income countries to predict and prevent outbreaks that might be worsened by global warming conditions.
Great. I mean, you mentioned dengue, and GLIDE, as you know, is based in Abu Dhabi. And I think earlier this summer, we had quite a spike of dengue in Dubai, which is just insane because people assume the UAE is a desert. Of course, there aren't any mosquitoes, but with the climate changing and sort of both planned climate change and environment change, and then the unplanned effects of the climate crisis, seeing this uptick in dengue, thinking about potential reintroduction of malaria, and these things that we thought were non-issues becoming potentially issues again. And I'm wondering if you could talk a little bit about sort of the impact then on health systems there, and some of the work that's needed to strengthen health systems to better adapt, but then also mitigate the impacts of climate on health.
Yeah, it's all about health systems, isn't it? Health systems are, generally speaking, our first line of defense, even where we have technologies, vaccines, or good therapeutics, or other ways to eliminate infectious disease. We still rely on strong health systems. And you're right, they're under a lot of pressure in the context of climate change. And some pressures are more relevant to the spread of infectious disease. Others, as I've mentioned, relate to non-communicable diseases, pulmonary and heart disease, for example. But in the infectious disease space, here's how climate change conditions are particularly worrisome and really putting pressure on health systems. 3 ways, I would say. One is as we've already discussed, diseases cropping up in new communities, in new locations. Healthcare workers aren't used to seeing the disease, so they're ill-prepared to test appropriately and treat. The countries may not even carry the most effective therapeutics where they exist. So part of it is just the spread into new geographies. But extreme weather is similarly complicating our efforts to eliminate diseases like malaria and dengue, and in fact threaten for to allow their expansion. Some of it is pretty intuitive. Flooding that results from extreme storms creates stagnant water where vectors like mosquito and others breed. And so there are more vectors there. And so transmission rates are higher. So if someone has the disease there, it's likely to spread much more quickly. Not only that, but it's happening in the aftermath of an extreme weather event, which may have disrupted health services more generally. So healthcare clinics are not open. Healthcare workers are protecting their families or recovering from the impact of the storm. So they're not available. And then sometimes even less intuitive ways, like prolonged drought, for example, will dry up rivers and also create stagnant water where mosquitoes can thrive. So that's another complication. So it's really the two things. One is the disruption of continuity of care, which we rely on in a healthcare system to provide good preventative, behavioral, advice and information services, but also therapeutic care. So the disruption to that is likely to increase the impact of infectious diseases. And then secondly, the actual conditions in a storm. So for example, in the sort of historic flooding in Pakistan 2 years ago that was all over the news and most people are familiar with, the impact of that storm was immense. But the part that maybe we weren't expecting is the very significant uptick in malaria afterward for both of those reasons.
Absolutely. And I think we're seeing so many of those extreme weather events. I mean, sort of the southern part of the United States was just hit with back-to-back hurricanes, and you saw the devastation there. Yet to know what the health implications are, especially from an infectious disease element there. But I think you're absolutely right. Pakistan was sort of the first time that everyone realized how much of a widespread impact the extreme weather events as a result of the change in climate could spread. But it also showed how Pakistan's healthcare infrastructure, specifically the polio immunization network, was able to pivot fairly quickly and still reach people. And I guess it comes back to that point around the health system strengthening elements and having people well-resourced and trained and nimble to adapt, which is not something, unfortunately, that's replicated everywhere. But maybe there's a glimmer of hope after last year's, and we worked very closely last year for COP, the UN Climate Change Conference, COP28, that was hosted in Dubai, and the first ever health day at a climate conference. Could you talk a little bit about the significance of that and sort of, there's been years of advocacy to get a more integrated health and climate sector response and recognizing that these two are very much linked. So wondering if you could just expand upon that and how that's sort of, I guess, supercharged FHF's work in the specific climate conference space.
Yeah, absolutely. I mean, you mentioned years of advocacy, and it's true. There were pockets of academic researchers working very hard to increase our understanding of the, health impacts of climate change and advocating for more investment. There were champions in the NGO and foundation world as well. But in general, we were very slow to recognize the seriousness of climate change as a global health and development community. So really not nearly enough work was being done in the 20 years where we should have seen it and weren't really acting. So we're grateful for those champions. And it's part of the reason that Forecasting Healthy Futures was launched in 2020, recognizing that not nearly enough attention, resources, investment, innovation was happening at the intersection of climate change and health. And so we advocated alongside a lot of organizations who had been working at this for far longer and really working to get the news out there, not just among the global health community, but among climate activists and stakeholders as well. But really, the COP28 in the United Arab Emirates was a major turning point in terms of the global recognition of the threat. And we're so grateful for that. We had been working, as you know, with Reaching the Last Mile based in the UAE, who had been a major contributor to forecasting healthy futures over the years. So we were pretty well positioned to help, alongside others, encourage the COP28 leadership team to take this step, to really explicitly make health a focus of the agenda in Dubai at COP28. We were thrilled to have the announcement made at our global summit that was held in Abu Dhabi earlier last year. And we were part of a whole chorus of organizations who really rallied around that focal point and that opportunity to put a stake in the ground, really, and say, as we negotiate on the climate front, which is so essential, and we definitely don't want to distract from the need to reduce greenhouse gas emissions, mitigate the impact of climate change. But even as we do that, we also need to be thinking about vulnerable health systems and how we can build them to be more resilient, and how we can be prepared to respond with the tools and the resources that we do have when there are upticks in infectious disease or other burdens of disease as a result of climate events. So Health Day in Dubai was a huge rallying call, and it really, even its announcement, kicked off a whole set of new initiatives and investment and innovation. And it's really kind of the sort of starting gun for a number of super incredible initiatives that I hope will have the impact needed in building climate resilient health systems.
Yeah, absolutely. I think it was really amazing to see that coming out of COP, and sort of how that's continued as well, with Azerbaijan and the host of COP29, and then Brazil, the host of COP30, and everyone really coming together to ensure there's that thread of continuity. And, you talked a little bit about how over the last 20 years of advocacy around the climate impacts of health, it's been very sort of piecemeal and slow. Do you think that one of the reasons could be that the health community were very guilty of waiting for the data and having like very strong evidence-backed data? But when you're talking about the health impacts of climate change, by the time we have that and peer-reviewed articles, it's already too late. So could you talk maybe a little bit more about IMAX and sort of the health modeling and climate solutions, and kind of what you're seeing there, and how some of the findings from there could be applied to help us get ahead of this? Because if we wait for the full data, it's sort of not useful at that point.
Yeah. We held a session at our most recent global summit in Baku with this exact debate. At what point do we have all the evidence we need to know that this is a serious threat, global warming, and how it manifests through many, many pathways, and we can turn to focusing on a response? And that's not to say that we don't continue to collect evidence, but we don't need that evidence to justify a response, right? We need it to inform our response. And I think with our Institute for Health Modeling and Climate Solutions, what we're focused on is, nowhere is that sort of knowledge to improve response more critical than in climate information services. Endemic countries have long used sort of the timing of rainy seasons to understand when they need to have commodities on hand, when they need to implement major interventions like testing and treating for malaria, how to deploy their healthcare workers to be when and where they're most needed. So that's not new, but the precision with which we can predict now is really unbelievable.
Absolutely. And I mean, that's really exciting because it shows that the predictions are there, the modeling is there, the data is there. For better or for worse, we're having real-time case studies, seeing the impacts of climate change on health. And it's sort of like, what else is needed to convince the powers that be to act now? And I know advocacy, in addition to the research that FHF does through IMAX and other vehicles, is a big part of your work. So how are you trying to encourage politicians and the people that really hold the purse strings and the policy pens to act now and to see that this is very much an integrated whole of society approach? And it's not just people or pockets, it's people, planet, and prosperity.
Yeah, I like that, people, planet, and prosperity. And you're right. And a big part of what we do is that advocacy. For years, we would have considered ourselves issue advocates. We just wanted this issue out there and discussed more, and the evidence that already existed brought to bear, and mobilize the resources to do something about it. Now, with the new sort of awareness level, we can afford to be more specific about what we're asking for. I was in a meeting with the Minister of Health from Malawi, Ms. Chipapanda, and she said, so what's next, after Health Day? Is it Health Week? Is it Health Month? Or are there specific demands that the global health community wants to make of the global community and development finance institutions in particular? So, one of the things that we think has been neglected is the compelling, persuasive power of the health argument to sway minds and, mobilize resources more broadly. So the climate change imperative has kind of neglected the health argument. So we're trying to get that out there. We're trying to make the health impacts of climate more visible to accelerate urgent climate action on the mitigation front. But that also has to mean that we're investing in adaptation. And adaptation involves again, responding with the tools and technologies that we already have, but using data to direct it more specifically. It means building healthcare facilities that are less dependent on energy sources. So they're solarized, and that's helpful both for continuity of care and for decarbonizing the healthcare system more generally.
That's really good. And I think it shows really that coordinated approach that FHF is taking to this and bringing on board from the beginning the health financing institutes and the development institutes who have, I think, historically programmed very sort of vertically or in silos without really looking at the sort of win-win benefits. Now, we're a few months, I guess 2.5 months from COP29. I know a lot of people are mobilizing towards COP30 in Brazil. And I'm wondering, what is sort of exciting to you? What gives you hope? What are you really looking forward to and seeing in terms of progress and sort of that promise that all of our excitement and the announcements will lead to something?
Yeah, a couple things. And I am optimistic, generally speaking, but we've been a little slow to follow through in terms of actual investments. And I think we might be, nearing a tipping point there as well. I would say by COP30 in Brazil, we will see some really serious changes in the investment frameworks that development finance institutes are using to determine the allocation of investments, loans, donations to the health sector. That the climate funds themselves will also begin to recognize the need for those funds in lower and middle income countries, work with those countries to kind of circumvent some of the really cumbersome bureaucratic and, administrative processes that have slowed the flow of those resources to where they're most needed. One thing quickly, Priya, I know that we didn't touch on is the inequity of this situation. And some of your listeners might not have thought about it this way, but of course, these countries where the impact of climate change is being felt the most acutely had very little to do with the global warming state that we find ourselves in now, right? They're among the lowest emitters of greenhouse gas, and yet definitely feeling the impact most. And so I think there will be a little bit of climate justice and just transition concepts and developed countries coming together to do more to protect the vulnerable countries that are experiencing the worst impacts of climate change.
Yeah, you're absolutely right. And thank you for ending on that. I think it's really important to make sure we come back to that point around equity and justice. And I know that, in the finance space, there's debt swaps for climate and debt swaps for health, and how we can sort of bring those together as well when we're looking at the financing elements. But thank you so much for joining us, Kelly. It's been a really exciting conversation. And I think folks we'll share the FHF website and resources to learn more about the work. So thank you so much.
Wonderful. It's been a pleasure. Thank you, Priya.